Welcome to Anatomy Physiology 1, Chapter 10 on the muscles. I thought this was funny because most of the names of the muscles are in Latin and most of them are not familiar to you. So luckily, the ones that we're going to be learning in this class mostly are the ones that you're more familiar with, but there's over 600 muscles and not everyone has the same muscles. So unless you're going into a field like physical therapy or sports medicine, something like that, where you've got to know all of the muscles, don't worry about learning all 600 of them. We're just going to take about 50 or 60 of them and expect you to know those. And most of those you learned in lab. Apparently, somebody was watching the muscles move underneath their skin and said, "Oh, look, it looks like mice running around." So they named muscles mice. Mostly it's the biceps that look like mice running around. Muscles make up about half of your body's weight. But one of the things that you do as you get older is the muscle mass gets smaller and the amount of other tissues, especially fat, adipose tissue, builds up. And so you may stay the same weight, but you may go up 4, 5, 6 dress sizes because you're replacing lean muscle with kind of fluffy adipose tissue. This is the anterior view, and most of these are ones that you learned in lab. We've already learned about the frontal region, the frontal bone, and now we have the muscle that runs across the frontal region. It's the frontalis, so that makes that kind of easy. And then the orbital areas, the mouth and the eyes, that's the orbicularis oculi, the eyes, and orbicularis oris for the mouth. The masseter helps you masticate your food, so that kind of makes sense right there. And we know about the zygomatic bone, that's your cheekbones, and so here's the zygomaticus major. So if you know the underlying bones, a lot of times that's going to help you out with the muscle. Now, one of the things that we're going to find is your muscles come in layers. So you have more superficial muscles, and then you have deeper ones. So what they've done here is they've shown you some of the more superficial ones, like the platysma and the deltoid. But if you take those off and look underneath, now you've got all of these other muscles underneath these more superficial, so you've got deeper muscles. Some of the names, like fibularis longus, runs along the fibula, and it's long. So that one kind of gives it away. And tibialis anterior would be running on the front of the tibia. So there you go. Some of them, soleus, they're trying to rename because it doesn't make as much sense. Gastrocnemius is one of the hardest ones to say. Gastrocnemius. Here's the gracilis running on the inside of the leg. So it would be medial, inside. Vastus lateralis would be on the outside, so it would be a lateral. And then sometimes they're named by what they do. The adductors are ones that pull the muscles in, and abductors are the ones that take them away. And I remember that because if you abduct a person, you kidnap them, you take them away from their home. So you abduct would be take away, and add, you're adding it towards the body. This chapter 10 only deals with the skeletal muscles, and it's mostly anatomy. It's the next chapter that we get into where we're going to talk about how the muscles actually work, and we're going to learn that there's 3 types of muscles. We have the striated skeletal muscle, the striated cardiac muscle, and then we have the involuntary smooth muscle. So one of the things we're going to learn about is that muscles are in compartments. They have connective tissue compartments, and this is going to be important because you can mess up the compartment. And we're going to learn about the shapes of the muscle fascicles and which of the muscles are stronger and why. And then we're going to look at where the muscles and bones attach. We'll spend a little time talking about that. And the author of this book does not like origins and insertions, but admits that unfortunately on boards and tests, you'll probably have to know the origins and insertions of some of the muscles. But as we're going to find out, sometimes the origin is where it should stay fixed, and the insertion should be on the bone or the tissue that's moving. But depending on which thing you do with a muscle, you can make the origin and the insertion switch places. So that's why he's campaigning against getting rid of origin and insertions. But he's fighting a losing battle at this point. I thought this picture was interesting. It shows what happens when you work a certain compartment of muscles, a certain set of muscles, without working the others. So no six-pack abs here, but look at the muscles right there for lifting weights. So that's your triceps and your biceps. We're going to find out that some muscles work in the area where they're located, but others, when they contract, are going to cause another part of the body to move. So we're going to talk about intrinsic, where they're working where they're located, and extrinsic, so they're external to the area where they're actually contracting. So we're going to see some examples of that. And then we're going to find different ways that muscles work together. So some of them work together, and you get more muscle action than you would if you just had one muscle. Some work against each other, which seems like a thing that you wouldn't want to happen, but we're going to find several situations where you want one muscle to work against another muscle. And we'll talk a little bit about nerve and blood supply, but not very much because we cover that in other chapters. And then I've already started out telling you a little bit about the Latin names of the muscles, help you remember them. Here's your typical Thanksgiving dinner in the home of someone who teaches anatomy. So instead of saying, who wants the breast, you say, who wants pectoralis major? And instead of saying, who wants leg, you say, who wants the gastrocnemius muscle? If you ask somebody, what do you do with your muscles? They say, well, I use them to move. Well, yes, you do. They're attached to your skeleton, and so your skeletal muscles make your skeleton move. So that would be one of the main things that it does. But it also stabilizes. So one of the things that older people have is our backs go out. So if we had nice firm muscles holding our back in place, then we wouldn't have so much of the lower back pain that seems to plague older people. We also control openings like our mouth, our eyes, so you can wink at someone, or openings like keeping from peeing yourself or pooing yourself. And you also make a lot of heat. So while you're busy contracting your muscles, you're using ATP energy and you're heating up the muscles. So a lot of times if you get really cold, if you move around, it warms you up. Or sometimes you're not even overheated, but you start working with your muscles and all of a sudden you get really hot and you start sweating. It's because you're making heat using your muscles. And then glycemic control, this is where you control your blood sugar. And the muscles will help you do that. So people who sit around and don't exercise tend to have more problem with diabetes than people who are out exercising. So you use the sugar in order to make ATP energy, in order to make your muscles work, and in order to make heat. So if you're using up the sugar, then it can't be building up in your bloodstream. We also use our muscles to move things within our body. For example, moving your diaphragm up and down is what allows you to breathe. Most people think that they're inflating and deflating their lungs, but you're not. The lungs are just passively riding up and down on the diaphragm. And we'll learn more about that when we do the chapter on respiration. It also helps with circulation. You know that sometimes if you're frightened, your face pales. What you've done is you've actually used little muscles to shut off blood flow to your face, and you've rerouted it to your arms and your legs so you can either run or fight. And digestion, if we didn't have sets of muscles doing peristalsis, then every time you tried to swallow, some of the food would squirt back up in your mouth and some of it would go down into your stomach, which is where you wanted it to go. We also use our muscles to talk, obviously, and to write, but we also have facial expressions. And I've mentioned this before, but I'll mention it again. There was a really great show on called Lie to Me, and it showed micro expressions. In the very first episode, it showed micro expressions for fear, and then it showed people who were showing that micro expression. And then it had micro expressions of people who were lying, and it showed a lot of famous people who were lying, and you could easily see the micro expression on their face. So there are some things you do with your muscles that are involuntary, and facial expressions are one of them. And dilation of your eyes, where your pupil gets bigger or smaller, that's another one of those involuntary things. And you can say a lot of things without saying a single word, just by hand gestures, facial expressions. You may think as you're sitting there listening to me that your muscles are relaxed, but that is not at all true. You have a number of muscles that have contracted partially, and they're maintaining your muscle tone. They're keeping you from falling over. They're stabilizing your joints. They're holding your airways open so that you can breathe. You are keeping some compartments of your GI tract open and some that are closed. And you do this by way of sphincters. So we'll talk more about sphincters, which are circular muscles, in just a second. But you can close off blood vessels with sphincters. You can close off the intestines. You can keep the food in your stomach from moving into your intestines with a sphincter. You can use the anal sphincter to keep from having a bowel movement. When you see the prefix MYO, that means muscle. So we're going to see MYO in a lot of different words. This picture shows us an indirect attachment of a muscle to a bone. So anytime you see a tendon, that would be an indirect because you have something that's between the bone and the muscle itself. And that would, of course, be the tendon. Some muscles are attached directly to the bone. If you remember from the bone chapter, we talked about a kind of a membranous covering on the outside of a bone called the periosteum. And here's the periosteum on the outside there, and attached to it and continuous with it is the tendon, and then attached to it and continuous with it is the fascia. And I wanted to point out two words that look a lot alike that you're likely to get mixed up. Fascia is one of them, there's the word right there, and fascicle, which is down here. Fascia and fascicle. And just as the periosteum is the membrane that surrounds the bone, the epimysium is the one that covers and surrounds part of the muscles. When they have what they call an exploded view, it's hard to tell whether to start down on the end and work your way up or start up here and work your way down. So we'll go both ways. So here's a muscle fiber, and we're going to learn in the next chapter about the actin and the myosin and how this contracts. So there's your muscle fiber, and you have several of these muscle fibers that are surrounded by this connective tissue membrane, and that's your perimysium. And then if you look at that, it is just one set of muscle fibers connected with or surrounded by the perimysium. So there you have all of these. Surrounding each individual muscle fiber, you have endomysium. Then the perimysium. And then outside of the perimysium, you have epimysium. And then the whole thing makes up a muscle fascicle. All right, so that's it backwards. Let's see if it makes more sense if we go forward. All right, we come from the tendon, and there's the fascia, which is the connective tissue that surrounds the whole muscle. So they've cut it away here so that you can see, but it surrounds the whole muscle. And then inside of the fascia is what we call the skeletal muscle, and that's the thing that we would give a name. We would call it like the... So there's basically 4 sets of membranes. The fascia around the whole muscle, and then if you look, see these individual areas, they are the fascicles, and they are surrounded by the epimysium. And then within the epimysium, so here's the epimysium surrounding this whole thing right here. Then you have the perimysium, which surrounds bundles of muscle fibers. And then if you look at the bundle of muscle fibers, then around each of the muscle fibers is a endomysium. I took some liberties and I added another word, the endomysium. So epimysium is around a whole fascicle, and each of these are fascicles. Right here, these are fascicles. So here's a blow up of one fascicle. Once you get into it, inside the epimysium is the perimysium, which is around these, which underlies the epimysium. Remember, epi means upon, para means around. And then, if you just took one of these muscle fibers, that's where your endomysium is. It's around just one muscle fiber. Also notice that you have nerve endings and you have blood vessels in there too. So one of the things that happens, this is nice that you have this nice firm fascia that holds everything together and keeps its shape. But if you over-exercise, one of the things that can happen is you can break some of these blood vessels in there, and then when you break blood vessels, you get fluid that leaks out. And then you also have the basement membrane, you have the areolar connective tissue, you have histamine release. So you're going to end up with fluid inside of this fascia, and there's no room for the fascia to stretch. So you can end up with nerve damage, and you can end up with these muscle fibers actually dying. So they call it necrosis. The name of this is Compartment Syndrome. And you know that you've got it when you start peeing really dark urine. Because as these muscle fibers are dying, they're going to release myoglobin. So when we talk about blood, we talk about hemoglobin and how we carry oxygen around. But in the case of a muscle, they have a more specialized molecule called myoglobin, and it's much more efficient at holding oxygen, which is good because you need a lot of oxygen to keep your muscles going. But if you have compartment syndrome and the tissue starts dying, then you're going to see the breakdown, you're going to see the myoglobin coming out in your urine. So it's good to exercise with someone who knows what they're doing instead of just doing it in fits and starts and doing way too much. There's so many ways you can damage your muscles if you don't exercise correctly. So here are the words that go along with that picture. The endomysium is the one that's directly on the muscle fiber and has capillaries and nerves. That's about all you have room for because it's such a small thing. And then you come out, and the perimysium is the thicker layer of connective tissue that's holding the fascicles together. And a fascicle is a bundle of muscle fibers wrapped together. And you're going to have nerves, and you're going to have blood vessels bigger than capillaries, and you're going to have stretch receptors. So this is going to be important. There, I added the word muscle spindles because that's what we call stretch receptors, muscle spindles. The epimysium is around the muscle, but remember, on the outside of the epimysium is the fascia. So don't get the fascia and the fascicles mixed up. The fascia is a sheet of connective tissue that separates neighboring muscles or muscle groups from each other and from tissue. This is an actual picture, and if it reminds you of a roast beef or a pot roast, then that's good because that's actually what we eat. We're eating the muscles out of an animal. All right, let's see if we can look and see. This one is running longitudinally like this, and this is a cross section. So the picture we saw before was also a cross section, but this is what it looks like longitudinally. So here's what a fascicle looks like if you're looking longitudinally. So there's a bunch of those fibers. Here's what it looks like if you're looking at it from the top, looking down. So this is a fascicle, this whole thing right there, from there to there, and then coming on around. And then the muscle fiber, so tiny in there. So this is magnified at almost 400 magnification. So to be able to see the nucleus in there, you know that you have to be really, really magnified. Perimysium, endomysium, and we don't see the epimysium because we're looking at a picture here, but the epimysium would be way out here, and then the fascia would be out there. We categorize muscles by how the fascicles line up. Which direction do they point? So here is one where they are pointing up and down from this tendon down to this tendon, and this is called the belly of the muscle right there. So this one is your biceps. If you see somebody who puts their fist up in the air and they're showing you off their upper arm muscle, that's what they're showing you. They're showing you their biceps brachii. Most people call these your abs. It's the rectus abdominis, or six-pack abs, so you can kind of see the connective tissue that's kind of dividing them off like this. And these are parallel. This one that has a tendon on either end is called fusiform because it's like it fuses at the end and it fuses at the other end. So it's fusiform. Triangular are fusiform at one end, right there, but it branches out into a triangular shape. So there's your pectoralis major, your pecs, when people are showing off their pecs. And then here is unipennate. So if you can see a feather, most of us have picked up a feather before. So here would be like the shaft of the feather. But this one only has feathers, or it only has fascicles on one side. So it's unipennate. And bipennate means it's got the fascicles coming off both sides. So it looks more like a real feather. And then if you look at your deltoid, that's your, if you put your hand on your shoulder at the top of your arm, that's where your deltoid muscle is. And it's multipennate. So here you have one tendon, but look at it branching off here and this one branches off there, that one branches off there. So it's multi-pennate. Looks like several feathers. And this is good because when you think about what you can do with your deltoid, you can contract part of the muscle and pull your arm behind your back, or you can pull upward and raise your hand like you want to ask a question, or you can pull on another side of the multi-pennate muscle, and you can pull your arm forward and nestle it up against your chest. So you have this range of motion, and the deltoid allows you to move your arm in all different directions. And then last but not least, you have circular. We talked about winking with your eye and opening and closing your mouth with a yawn or speaking. But here's one of my favorite cartoons. If you really do it correctly, if you really relax the muscles in your body, you'll fart. So here are all these people in yoga class, and they're relaxing every muscle in their body, and their sphincter, which is the circular muscle, releases the gas that's trapped in their intestines. The fusiform muscles, like the ones in your upper arm, and we're going to find out you've also got those down in your legs also, are going to be the stronger one. You're going to get more bang for your buck in this particular form. They'll be your stronger muscles. So revisiting muscle compartments, it is several functionally related muscles enclosed by fascia. It also has those nerves and blood vessels inside there that you have to have in order to get food to the muscles, to get oxygen to the muscles, to get the waste away. So here's a slice through somebody's leg in the gastrocnemius area, so your calf muscle right in through here. And you've got, here's the skin, there's the fat underlying the skin. Here is your little fib, your fibula, and your larger tibia right there. And then there's the various muscles in through there. And these are considered to be a compartment. When we think about tendons, we usually think about tendons like the one that was on the fusiform, where it's just kind of a rope at the end of the muscle. But we're going to find that there are other shapes of tendons. So we'll look at some of those in just a minute. Remember that tendons connect muscle to bone. It's ligaments that connect bone to bone. Ligament is bone to bone. Tendon is muscle to bone. So you've got a lot of collagen fibers. You need some strength in there, in the endomysium, perimysium, the epimysium, and they are continuous with the tendon. So that means if you're looking at that tendon and you're coming down, the outer covering of the endomysium, the outer covering of the perimysium, and the outer covering of the epimysium all join with the tendon. Here are the intercostal rib muscles, and they have a direct attachment. So there's the periosteum, the little membrane that's around the bone, the rib. And you see that there's not a big tendon there attaching it. And this is interesting because you can rip your intercostal rib muscles. So there's somebody who's done that. But this is called direct attachment. If the tendon is spread out, it's broad, it's flat, then we call it an aponeurosis. And this is because one of the first ones that they named was on the skull. So they just kept the name. But here's one that's on the hand. So it's flat and it's spread out, but that's a tendon right there, aponeurosis. And then you can have the tendon in a band, and this is a retinaculum. right there. And it's almost like this person is wearing a bracelet, the retinaculum. You also have one around your ankle too. Here's a cartoon version showing the palmar aponeurosis. And then there's the retinaculum that goes around the wrist. If you didn't have that band holding these tendons down, whenever you moved your fingers, they'd pop up. You'd have all these popping up. So here's a picture where they've removed this so you can actually see the tendons and how they're attached to the muscles up here. So you don't have muscles in your fingers, you have these tendon endings. So your fingers are like puppets that are being manipulated by these muscles up here. I thought this was cute. I wish I was this clever, but I'm very good at stealing clever things to show to you guys. The gastrocnemius muscle is a classic example of the problem with talking about origin and insertion. So the rule is one part of the muscle is anchored, so it is stationary, and when you contract the muscle, it causes the place where the insertion is, the other end, or the other tendon, wherever it is, it causes that bone to move, or whatever is attached to move. So the insertion is the part where it moves, and the origin is the one that stays stationary. Well, look at your gastrocnemius muscle. It's connected to the Achilles tendon, or the calcaneal tendon, that attaches to your heel bone. So when you contract it, if the origin is the heel, then the insertion is where you're going to flex your knee. So that's the part that's going to move. But you can also flex your gastrocnemius muscle, and instead of your knee moving, you will pull your foot down. You'll do a plantar flexion of your foot. So which is the origin and which is the insertion? In that case, it could be either way. You'd have to define the motion that you're using the muscle to pull to tell, which is the origin and which is the insertion. So they're trying to start saying proximal and distal, or superior and inferior, instead of origin and insertion. But again, you probably want to know the origin and insertion of the major muscles, because you'll probably see them on your national boards. Some muscles are not attached directly to a bone, but they're attached to the fascia or a tendon of another muscle. Or, in the case of in the face, you have collagen fibers in your skin, in your dermis. You remember your epidermis and your dermis and your hypodermis. So you've got collagen fibers in the dermis, and you can have a muscle directly connected to the collagen fibers. So there's no bone there. And by contracting the muscle, it causes your skin to do things. Now, we talked briefly about the Erector Pili, which is a little muscle that is attached to the hairs that are under your skin. And when it contracts, then you actually see a little goosebump. It causes the hair and the skin underneath it to stick up in a goosebump. So that's another case where you don't actually have a tendon attaching to a bone. You have the collagen fibers of the tendon attaching to the skin. And I kind of like this. It takes 37 muscles to frown. It only takes 12 muscles to smile. So it'd be easier to smile all the time. But if you don't use any muscles, then you look like that. So if you ever have somebody who is pretending to be asleep, all you got to do is look at their face. If they're truly asleep, their face will sag. So if they're still smiling, or trying to pretend to be asleep. It's really easy to tell. So 2 words you need to know, intrinsic and extrinsic. We've mentioned it before, but I'm going to do it one more time to make sure. So here's an example of intrinsic and extrinsic. So in the hand, to make the palm move around, you have intrinsic muscles. But in the case of the fingers, where you don't even have muscles in your fingers, then you're going to have extrinsic or external muscles moving your fingers. So there's extrinsic, and then there's intrinsic. And we categorize muscles by what action that they do. So we have 4 basic actions. The prime mover is actually called the agonist. So the muscle is the thing that causes the primary action. It doesn't need anybody else. It's just doing its thing. So we call it the prime mover or the agonist. Now, if you have a muscle that is helping out, we call it a synergist. So they work together so you get more bang for your buck. You get more force by contracting both the synergist and the prime mover. Now, sometimes you need to pull something. And if you stop and think about it, your muscles only contract. So you can pull with your muscle. But how do you push with a muscle? All right, you're contracting, you're getting shorter. So how would that make something pull? So the only way you can do that is by having them work as a pair, antagonist. So my favorite is when you're looking at your arm and you're looking at your biceps. In order for your biceps to bunch up like that, you're going to have to extend your triceps underneath. And then when you want to release or relax your biceps, you're going to have to constrict or contract your triceps. So we have pairs of muscles that work together in opposition so that we can push and pull. And then the 4th class, the example that will probably make more sense to you is the rhomboids in your lower back that are attached to your scapula are going to hold the scapula in place while you're busy moving the biceps. So the biceps are also attached to the scapula. So if you were doing that where you were flexing your biceps and you didn't anchor the scapula down, then you pull the scapula also at the same time you were trying to raise your forearm. So here are your rhomboids that are holding your scapula in place. And here are your biceps also attached to the scapula. So these are the fixator muscles, and this would be the prime mover. Right there. And now you know it's called biceps. It has 2 points of origin. Here's a picture of the antagonistic pair. So here are your biceps brachii, right there. And then there's your triceps brachii, right there. So when one of them is contracted and bulging, the other one is extended or relaxed. And then when this one contracts, this one has to relax. And that's how you can raise, you can push and pull your arms up and down. In the next chapter, we're going to learn about how muscles contract and how you have to have electrical energy and chemical energy in order to cause it to happen. So if a nerve dies, then the muscle that it was telling to contract will no longer contract. So there's nothing wrong with the muscle. It's just waiting for a message that can't come anymore. So nerves are necessary to innervate a muscle. So if you're finding muscles that aren't working correctly, then what you're going to do is you're going to start looking at the various nerves. And we have several chapters where we're going to be talking about nerves. And we have spinal nerves, we have cranial nerves. Sometimes there's even a brainstem injury. So that one could cause a lot of muscle paralysis. And we talk about quadriplegics and paraplegics. Depending on where you break the spinal column, the muscles from there down don't have any way of communicating. So they're flaccid. They won't contract. Now, you could apply an external stimulus and cause the muscle to contract that way. So a lot of times they use TENS units. As you can see, you can get TENS units for anywhere from $30 all the way up to professional ones, which are considerably more expensive. But you need a doctor to tell you how to use it, a physical therapist to tell you how to use it. So here's some of the stuff that you can read about on the web, how you can use a TENS unit to get rid of pain, reduce muscle spasms, and then of course people are like, hey, can I use it for muscle building so I don't have to exercise? And it says, well, no, it won't directly tone your muscles because it doesn't cause them to contract that much, but you can indirectly promote more rapid muscle growth. We have a whole chapter on spinal nerves, so all we pretty much need to say is that your spinal nerves come out between the vertebrae. They emerge through the intervertebral foramina. We also have a whole chapter talking about cranial nerves. So we're going to find out that there's 12 of them, and they come out through the skull. They innervate the muscles of the head and neck, but then some of them stay in the skull and they take care of your hearing and your eyes. So we're going to learn about the optic nerve and the auditory nerves in one of the chapters coming up. Now, you've got to have a lot of blood flow to the muscles, which is why they tend to be bright red, because they are full of blood. At least a fourth of all the blood is going to go down to your muscles, and if you're exercising, you can go up to like 75% of all the blood goes to your muscles. So you can reroute it away from places you don't really need it at that particular moment in time and send it to the muscles. So what can using your muscles do for you? It can increase your muscle mass and reduce your fat. It can give you a better mood. So these are the pros of exercise, why you should do it. It will give you more energy. It will improve your heart. We call it cardio, doing cardio exercising, and make you stronger. The cons is you actually have to exercise. You can't look for a TENS unit to do it for you. Two muscle areas that people try to exercise are your upper leg, because a lot of the exercising that you do, and a lot of the muscle that you have is along your femur because it's the biggest of the bones. So you can get a lot of exercise bang for your buck by working your legs, which is why so many people run, jog, and walk. They also work on their core. So they work on their abdominal muscles. And this I thought was funny because one of the things they talk about are people who are shaped like an apple and people who are shaped like a pear. So here's two pears who are saying, I've been working on my core. So they're not as large at the bottom. anymore because they've been working out. Hopefully you have an idea of what you want to do with the anatomy that you're learning. And again, those who want to be physical therapists, physical therapy assistant, occupational therapists, sports medicine, sports trainers, any of those things, you would need to spend a little more time than other people going through the muscles, knowing how the action of the muscle, the origins, the insertion, how to work with groups of muscles. But one of the best ways of learning them is finding something funny that'll help you remember it. That's the way I do it. I do a lot of humor. You may have noticed some of my jokes that I put on the slides may not be as funny as I think that they are. But the words are going to have some either the structure, the location, or how the muscle actually acts. So a depressor obviously is going to push something down. And labii, well, you have labia in various places, but this happens to be in your face. In inferioris, this is going to tell you that there is going to be something that's superior in this area, but this is the one that is inferior. And flexor is going to cause you to flex something. A digiti, well, you know that your digits are either your fingers or your toes. And minimi brevis. So this is going to be a small, short muscle. If you want to learn how to pronounce these words, here is a website. So you can go through and just pronounce the word. Just spend a little time so that you don't trip over them like I did a minute ago when I was trying to say aponeurosis. Another thing that studies have found, if you just sit and try to run through a list of things over and over and over again, you really won't retain it very well. But if you pronounce it, then you're hearing it. If you see it, then you have a visual. If you make a joke about it, then now you have an emotion that is attached with it. The more of your senses you can involve in learning these words, the more likely it will stay with you. So here's an example that I found. Here is your extensor digitorum. And it extends your digits. So the name kind of gives it away. And we've been looking at the fingers and how they don't have any muscles. They just have those tendons attached. So this is going to allow me to extend my fingers. And here's a little cartoon that somebody put. Here's your extensor digiti mini-me. If you didn't see that movie, then you have no idea who Mini-Me is. Some of the muscles you can actually feel on yourself. So you can palpate, like the biceps, of course. You can feel and see if you can find the two origins up on the scapula. Locate the attachments of muscles on articulated skeletons. Remember, when we were learning the bones, we saw the tubercles, we saw the crest, we saw all these things. Those are points of attachment for muscles. That's why you were learning them. If you say the names aloud, if you say them with your study partner, it's really a good idea to get a study partner. Look at models if you're in the laboratory. Look at pictures of cadavers. There are dissected animals online. There are YouTube videos. There are photographic atlases. There are so many different ways that you can look at the muscle until it stays with you and you see it and you're like, okay, I got it. And you've got these pictures that are, some of these are in your lab manual, some of these are in your textbook, but you can look, be sure you look at the anterior view and look at the posterior view. So some of them come around. So you can see it in the front and in the back. But some of them are only visible from the anterior view or the posterior view. Here's your deltoid. Looks like a cap right there. The platysma is, the guy goes, it's not really useful for very much of anything unless you're shaving, and then you can just kind of pull your neck out so you can shave more easily. And I just thought, that is so funny. But anyway, so there's that one. Again, remember the superficial versus the deep. So that's gonna confuse you a little bit. Superficial and deep. It sometimes helps also to look at an action. For example, which muscles would I use to frown? Which muscles would I use for chewing? Which muscles do I use for swallowing? Those are two different actions. Which of the neck muscles move your head? Look at the attachments, so the origin and the insertion. What action? It causes you to raise something, to lower something. And then we won't learn the innervation until we do the cranial and the spinal nerves. But realize that there are nerves that are causing each of these muscles to do what they do. One of the things that people who are in the public eye worry about is, what does their face look like? Because that's how they make their living, the actors, the people who are TV commentators. And one of the things that we do over time is we frown, and we start getting frown wrinkles in our forehead. So they've discovered that if you take something like Botox, which is toxin made by botulism, and inject that in, it'll paralyze the muscles. And that way you can't frown. And so you're not going to get those wrinkles, the frown lines and the wrinkles. Some of the muscles are named from the area, like the frontalis. Here's the temporalis, the temporal region. Occipitalis, right there. And here's the sternocleidomastoid. So it's going to attach down here and go all the way down to the sternum. So that's kind of a big, important one. So I recommend that you do learn that one. So on another slide, we looked at the depressor labii inferioris. And here it is, right there. So it is a depressor, and it is around your lips, labii, and inferior. We spoke earlier about the direction that the fascicles go, and that's the direction that you get the muscular contraction. But in a thing like your tongue, you've got to push your food around. You've got to force it back into the throat so that you can swallow it. You have to be able to move your tongue all around to speak. So you've got vertical fascicles, transverse fascicles, and longitudinal fascicles. So they're going in all different directions. And they are embedded in the tongue. Intrinsic means they are part of the tongue. So it's not like your fingers where you have extrinsic pulling on your tendons like a puppet. Now, I spent about 15 years with the military, but even before I went in, I already knew plenty of cuss words. And so I identify with this old lady. I pulled a muscle when I was mowing the lawn. It was in my throat. It was from cursing at the pull cord. In the very first slide, it's like, so your anatomy teacher says, where's the mylohyoid? And I'm like, I don't know. But now, here it is. Although they've cut it away so that you can see some other muscles. Even if you don't want to memorize all 600 of the muscles, it is kind of neat to think of all the stuff that you can do with your muscles. For example, just opening your mandible, just opening your mouth. You have to have some muscles that will let the lower jawbone drop. You have to be able then to pull it back up. You have to be able to grind, so you're pulling it back and forth. You have to have incisors cutting, so you have to pull back. When you put your teeth together, the incisors don't usually sit right on top of each other. So you're going to have to pull those back so you can bite your steak or bite your celery or whatever it is that you're eating. And then retraction, you got to make your rear teeth meet. So you're going to pull back and grind. So you're going in all directions. So you have to have at least 4 pairs of muscles working antagonistically to be able to eat your food. If you're going into dental hygienist or going to be a dental hygienist, then you probably should learn all of the muscles that help you chew. And in case you want to wow people, you can say, well, the mylohyoid is the one that raises the floor of the mouth just as you're beginning to swallow. And these are your superficial muscles of your neck. And there's the deep ones right there. The hyoid bone that we learned about when we did the skeletal system is really cool because it allows us to do all sorts of things with our voice box, our larynx, to help us talk, to help us swallow. And here's another view of the Sternocleidomastoid. Right there. The back of your throat, just as you pass your tongue, is called the pharynx, and it makes a funnel, so the food goes from your mouth through this funnel of your pharynx and pushes the food down into the esophagus. You should learn the trapezius, which is over here, trapezius, and know that it helps you extend your neck. So you can flex your neck with the sternocleidomastoid and extend it with the trapezius. I think this slide is funny because it says contralateral is moving your head the opposite side and ipsilateral is moving your head towards the same side, but it doesn't say the same side of what. So you're going to have to say, I need you to turn your head to the left. And then if they move their head to the right, then they were doing contralateral. They turn different way than what you wanted. The muscles in the trunk of your body, or what they call your core, would be your muscles of respiration, muscles that support the abdominal wall, so your belly doesn't hang down, the moving of your vertebral column, and muscles that support your pelvic floor. So ladies are very much in touch with their pelvic floor, especially if they have been pregnant, because you learn to do Kegels, you learn to strengthen that. You should definitely know what the diaphragm is because your lungs ride up and down on it, and external and internal intercostals. So we saw a picture of those where you have the muscles that connect the ribs. This slide cracks me up because it says, which are the muscles you use to breathe for respiration? Well, there's your sternocleidomastoid again, that's in your neck, your scalenes, your pectoralis major, serratus anterior, latissimus dorsi, your internal and external obliques, your transverse abdominis, and your anal muscles. And you're sitting there going, I use my anal muscles to breathe? The diaphragm is a kind of a dome that the lungs sit on. So when you contract the muscle fascicles of the diaphragm, it's going to flatten it. So it's going to pull it down. This makes the thoracic cavity, the part that's holding the lungs, much larger. So the lungs will inflate. They will pull in air through your nose or your mouth. Then when you relax the diaphragm, it raises back up. And when it raises back up, it pushes the air out of your lungs. So it's kind of backwards of what you would think. Your external intercostals are going to elevate your ribs. They're going to pull them up, so they're going to help expand the thoracic cavity. And they also make a vacuum in there. So unfortunately, if somebody stabs you, then it'll release that vacuum and your lungs will collapse. So when we get into the chapter on lungs, we'll talk about a pneumothorax or a collapsed rib. There's your external intercostals. There's your internal intercostals underneath it. The tendons of your oblique and your transverse muscles are going to be those great big flat sheets. So if you have one, it's an aponeurosis. And if you have several of them, it's aponeuroses. I said that wrong again. Aponeuroses. I feel just like I'm doing a TV show. They always stop at just that moment. You're like, no, don't. I have to know. Don't end right there. And you have to tune in next week for the rest of it. So I'm going to stop right here, and hopefully I'll come back with part 2 and tell how you use your anal muscles to breathe.